Live, local, late breaking. WPBF 25 News at 9 starts now.
Welcome back. According to a new study at Lynn Women's Health and Wellness Institute, artificial intelligence, or AI, is helping to catch breast cancer that a traditional mammogram does not detect. Here with us today is Dr. Kathy Schilling from the Institute at Baptist Health Boca Raton Regional Hospital. Dr. Schilling, thank you so much for being here with us this morning. So how is this AI technology revolutionizing the screening for breast cancer?
Well, we've been fortunate here at the Women's Institute for the last 3 years to have the assistance of artificial intelligence in helping us to screen women with digital breast tomosynthesis or 3D mammography. When we went in 2014 from digital mammography to 3D mammography, we went from 4 images per exam to 280 images per exam, and so we became overwhelmed. And realizing that about 90% of the cases are negative, you can really get mesmerized and get fatigued by looking at normal exams, and you can lose focus. So we've used AI to help us in identifying small cancers. You know, your iPhone can recognize your face, and we can teach computers to recognize the appearance of cancers on mammograms. And that's what it does. It helps us to refocus our attention to areas that potentially may be representing a malignancy on the mammogram.
And Dr. Schilling, I was looking at some research that was being done. So I read that 1 in 8 cases of cancer are not detected in a traditional mammogram. So can you share with us just some of the most impressive statistics that you saw that came out of this study?
Well, our study looked at 2 years before are using artificial intelligence as well as 2 years afterwards, and we looked at over 100,000 images or patients. And we have 9 dedicated breast radiologists at the Women's Institute. All we do is read mammograms, so we thought we were really pretty good. But we looked at our cancer detection rate before and after AI, and we found that we increased our cancer detection by 23% when utilizing artificial intelligence. And this came without an increase in false positives. So we weren't recalling patients for additional testing or unnecessary biopsies, and yet we still gained in the number of breast cancers that we're able to find. And this was really quite surprising, since we thought we were pretty good being dedicated breast radiologists. So just imagine what it can do to someone who is a general radiologist reading mammography on the side.
Dr. Schilling, I mean, 23%, that is a significant number. So how do you think that this study will change the approach in caring for patients?
I think that we are going to be finding smaller and smaller cancers, and I have the hope that it's going to bring us to the next level of care for patients, where we'll be offering them lesser surgery, fewer mastectomies, smaller lumpectomies, perhaps no chemotherapy, less radiation, as we're finding these very, very early cancers that we're probably seeing 1 or 2 years before we would have found them without the use of artificial intelligence.
And before we let you go, what is the next step for this study?
So I'd like to take a look at that specifically, to evaluate what are the size of the cancers that we're seeing now compared to what we were finding before. How did they present, and what is the pathology? Because there's certain pathologies that are more difficult to find, and I think AI is really helping us find these small, very difficult but clinically important cancers.
Dr. Schilling, thank you so much for joining us this morning and bringing us this critical information. If you would like more information on how artificial intelligence is being used to detect breast cancer, you can head to our website, WPBF.com.